This question says some patients have replacement valves. These might be mechanical or biological from a pig. We've got to suggest 2 reasons why a patient may choose a mechanical valve and not a biological valve from a pig, and it's worth 2 marks. We're also given a table of information, both mechanical valves and biological valves. It's a suggest question, therefore we've just got to give sensible reasoning, and we've got to say why a patient would choose a mechanical valve over a biological valve from a pig. So first of all, it says mechanical valves are made of plastic or metal, therefore they're long lasting. It also says there's no need for another replacement valve after 5 years, so therefore we don't need to go to the hospital or to have surgery again. Because we're using metal or plastic and we're not using living tissue, there's no ethical issues. And because we're not using living tissue, there's no risk of rejection. Therefore, the patient will not need to be taking anti-rejection or immunosuppressant drugs for the rest of their life. Because we're also not using living tissue, there's also no risk of transmission of disease. So we'd need 2 of these 6 marking points to gain 2 marks.